Hi, welcome to KidzDocTalk with Dr. Jennie. Today's guest is Dr. Melissa Diamond, discussing cardiac effects and sports clearance after COVID. Dr. Diamond grew up in South Florida. She completed her undergraduate and medical school at the University of Miami, continued on with her residency in pediatrics and fellowship in pediatric cardiology at the University of Miami, Jackson Memorial Hospital. She has been with Pediatric Associates for the last 4 years. Welcome, Dr. Diamond.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the director of telemedicine at Pediatric Associates.
Hi, Dr. Diamond. Thank you so much and welcome.
Hi, thanks so much for having me.
I'm excited to talk to you about this very important topic of all things little hearts and how they relate to COVID and kids. So I want to get started and just ask you kind of right off the bat, what are some cardiac effects that you have been seeing and that's been reported in kids who have been exposed to COVID?
Well, I know that the cardiac effects of COVID have definitely been prevalent, and we see them all over the news, and that, it's a big talked about subject. One of the big things we do see that we talk about a lot is the MISC, the Multisystemic Inflammatory Syndrome. I mean, it's something that's rare. It's only in about 0.2 to 0.6% of the COVID-19 cases. However, it is prevalent and can be pretty severe. Some of the other things we see are myocarditis, which is the inflammation of the heart. Also, we can see the pulmonary hypertension, sometimes even arrhythmias, clotting, or even sudden death.
Are any of those things that you end up seeing like in the clinic, or are they oftentimes kids who have been like hospitalized for COVID and then just kind of end up coming to you for follow-up?
Frequently, they're seen more in the hospital. However, if a patient does come to us that's very ill, we can pick it up in the clinic also. But a lot of these patients are hospitalized for their management.
Are any of the things that you mentioned, obviously, right, not the MISC, that's pretty severe, but some of the other, like maybe arrhythmias or some other more subtle findings, do any of those ever come as without any symptoms, asymptomatic, and, somebody just, pediatrician just refers to you after a kid has been exposed to COVID, or how are these typically picked up?
A lot of them are usually picked up with symptoms where the patients have chest pain, they'll have palpitations, which is like a fast heartbeat, trouble breathing, passing out. They may just feel more tired than frequently. So usually they are symptomatic. I mean, there are some cases that we've seen of a subclinical myocarditis that can be picked up also.
Okay. So I know this is changing constantly, changing every day, but the big thing that we're seeing right now in just as general pediatricians is the request to get kids cleared for sports after exposure to COVID. So I really want to make sure that we talk about this. What are the current guidelines for return to sports? Can we just clear all kids who have been exposed to COVID to return to sports? Or is this something that we should always be sending to a pediatric cardiologist?
So the current guidelines have been showing that children who test positive within 6 months for COVID and want to play sports should be evaluated by the pediatrician. Based on the screening by the pediatrician and the severity of the symptoms the patient had, then they may require evaluation by the cardiologist. If they do come see one of us, a lot of times we'll need an EKG, depending on the symptoms, an echocardiogram, which is an ultrasound of the heart, and sometimes even we do draw labs to make sure everything's okay based on the results.
Okay. Of the kids that you've seen that have needed that, extensive of a cardiac workup, have you had any so far that you've been unable to clear based on their, some abnormal findings?
Personally, I haven't had any that I haven't been able to clear, but I know of plenty of cardiologists that we do pick up patients that have had, evidence of myocarditis or cardiac symptoms that do need evaluation. Some of the patients may have other pulmonary symptoms that need further evaluation. So it's not always just a cardiac symptom.
Makes sense. That's true. We're talking about sports, right? We can't just be talking about the heart. We also have to be talking about the lungs. So I think that's an important point, is that I think we always talk about COVID as being pretty minor in kids, and right, for the most part, they do well. But I think we sometimes forget to think about all these pretty important consequences that can happen that maybe limit them and their activity levels in the future.
No, and with that also, that's why now with the guidelines, they started this graduated return to play protocol, because these patients, they haven't been playing sports because again, they were sick, they weren't feeling well, that now they have to slowly start to exercise, where they have to be at least 10 days of rest and 7 days symptom free before we can even start to exercise. And then again, it's a slow process. It sometimes it'll take over 3 weeks to slowly start to exercise.
Okay. So I think that's a good point. It's important for us to remember. So you mentioned myocarditis or subclinical myocarditis sometimes as one of the things that gets picked up with COVID. I think that word has been in the news a lot lately because it has started to sort of become very relevant when we talk about the COVID vaccine. So I want to talk more about that. But first, what is myocarditis?
So myocarditis is more of an inflammation of the heart muscle. A lot of these patients will present with, again, similar to what we were talking about before, with the chest pain, the palpitations, the shortness of breath, passing out. And some of these patients are presenting post their COVID vaccine. Usually it's been seen in about the 16 males greater than 16, most frequently after a couple days after their second dose of the vaccination. And a lot of times they'll come in, they'll see us, they can have abnormal EKG, some have abnormal findings on echo, and a lot of them also have abnormal labs. But the most important thing is that these patients that do have myocarditis post-vaccine, for the most part, it is a mild case. And even if these patients do require hospitalizations, it's a couple of days, and over 80% of them, based on the data we have now, are recovering very well.
That's fantastic. Is this myocarditis that happens after the vaccine, does it look similar to the actual myocarditis kids get after a COVID infection? Is there any difference either in presentation or severity?
This myocarditis that the patients are getting after the vaccine is much less mild than what can happen with actual COVID. The most important thing I think that for people to remember is that the myocarditis after the vaccine is much less mild than the true COVID myocarditis. And that's why getting the vaccine can help prevent the true COVID myocarditis.
That's interesting. That's actually really important, right? Because I think we think like, oh, it's inflammation in the heart. If they can get it with the infection and with the vaccine, why would I pursue the vaccine? But it sounds like really the consequence from the infection is much more serious. And
yeah, it's definitely
is not.
Exactly. I think that, and that's the most important take-home point, is that without the vaccine, it is much more serious. So that's why getting the vaccine, there is a low risk as of what we know now to get the COVID vaccine myocarditis. I think right now the preliminary numbers are about 16 to 30 patients per million of patients who have gotten the myocarditis post-vaccine.
So we can talk a little bit more about your recommendations for kids to get the vaccine, but I want to just switch gears a little bit and focus on a special patient population, which are kids with congenital heart disease or kids with any kind of underlying cardiac pathology, right? Basically anyone that doesn't have 100% healthy hearts. Are you recommending those kids get vaccinated, or is this a population that should be holding off?
Right now, we're still recommending that they should get vaccinated because, again, the diagnosis of COVID and getting sick from COVID appears worse than the vaccine.
And then what about kids who have normal heart, regular healthy kids, right? Anyone over 12 at this point? What are your recommendations to those patients?
I absolutely believe that they should all get vaccinated, that the risk of COVID is much worse than the risk of the myocarditis with the vaccine. And that we can get much, much, much sicker with actual COVID than the vaccine.
I think that's a really important takeaway, and that's sort of been a takeaway, I think, with me asking almost every specialist that we've had so far, right, talking about COVID, and even Gen Peds and their experience with COVID. I think as a whole, that's really our takeaway, is that there's huge value and benefit to the vaccine, and really we at this point continue to recommend it for kids greater than 12. Any major takeaways, anything that you really want to make sure parents and even we as general pediatricians know about cardiac consequences of kids who are exposed to COVID or who have gotten the infection?
I think some of the major takeaways are, watching your child. If they are developing symptoms, the things that we've talked about, the chest pain, the shortness of breath, palpitations, fatigue, passing out while they have COVID, they should get checked out either by the cardiologist, or some of them may require evaluation in the emergency room because they may require hospitalization depending on the symptoms. Some of these patients who do develop the severe symptoms of COVID, such as the MIS-C, do require hospitalization. And it can be even something harder to diagnose because it looks and mimics some of the other diseases that we do see in children. And the most important is that they should get vaccinated. Everyone over 12 years old should get their COVID-19 vaccination because the risk of COVID is much worse than the risk of the myocarditis post the vaccine, because the myocarditis post vaccine has been very, very mild. And these patients are making a full recovery and doing great. Whereas COVID myocarditis, for patients who actually have COVID, may have a much worse prognosis.
I think that's the most important takeaway. And hopefully that remains our recommendation. As we spoke about earlier, information is constantly changing and we're getting new updates every day. So at least at the time of us recording this conversation, this is kind of information that's known, but certainly we'll keep an eye on things as they evolve and be sure to update everybody if guidance or anything else.
Because guidance I know changes daily. I know that we're still waiting for the ACIP meeting results to come out and see if any new guidance comes out, but I'm hoping that everything will stay pretty similar, that, we're still recommending that patients get vaccinated to try to curb this COVID-19 pandemic.
For sure. Excellent. Thank you so much. This has been so helpful. Thank you for all your information.
No problem. Thank you for having me.